OCR HIPAA compliance. Before we begin, we're going to cover a few housekeeping items. First of all attendees are set to listen-only mode, and this is to help keep background noise to a minimum. You may use the raise hand, ask question, or chat button near the left side of your meeting manager pane to contact us at any time during the presentation. We will hold a Q&A at the end of the session, but please feel free to submit your questions at any point during today's presentation. We are also recording this session and will make it available on our website within the next couple of days. And you will receive a follow-up email tomorrow that will include instructions on how to download your CEU certificate. So at this point, I would like to introduce you to our presenter for today, who is Amy Durling, RHIA CHA. She is our Chief Privacy Officer here at IAD Incorporated. Amy is responsible for ensuring that IAD is 100% compliant with health information privacy and security standards, specifically as they relate to the processing of release and sharing of healthcare information, whether it be with health information exchange, meaningful use, or legal requests. I will now turn it over to Amy.
Good afternoon, everyone, and thank you for joining our session. Again, we're here to talk about how we can navigate the new OCR privacy and security audit process. So is it really necessary now? Like ICD-10 isn't enough, and the implementation of the final omnibus rule. Now here comes the OCR to add its muddy boots to your once white carpet. Well, don't panic like this lady. Hopefully after today's session, you'll begin preparing if you haven't started already. But why are we being faced with these audits? Well, the OCR is looking for compliance to the HIPAA privacy, security, and breach notification requirements. This is why we're here. When we look at the reported breaches from 2009 to 2012, there were 538, but 21.4 million patient records were affected by those breaches. The OCR and CMS look at these numbers and ask themselves, could this be happening if business associates and covered entities were complying with the HIPAA regulations? Some recent news that we've learned is back in 2012, Eastern European-based hackers attacked the state of Utah and exposed claims data for over 780,000 children's health plan recipients. If Utah had followed the HIPAA regulations and based upon risk assessment encrypted their servers, would this have happened? No. And in 2010, a new employee's laptop was stolen with 61,000 unencrypted patient records. The facility had a policy in place stating that all portable computers must be encrypted, but they just didn't follow their own policy. And in 2012, an employee of the Health and Human Service Program emailed himself 228,000 patient records. Do you think this could have happened if they had the kind of access controls recommended in the security regulations? With this information, OCR is concluding that some of our organizations, covered entities, and business associates are not HIPAA compliant. So what are the purpose of these OCR audits? Well, based on the HIPAA audits that were completed in 2012, the initiative was a compliance activity. It was not for enforcement. This is not to say that they couldn't lead to enforcement action, but that has not been the case at this point. The goals of the audits was to bring to light the privacy and security responsibilities that a covered entity and business associate has to hopefully assist in the sharing of best practices amongst all covered entities and business associates based on the results of their audits. Dave Mayer, who's a senior advisor for the OCR, stated that the audits are a wake-up call to covered entities and business associates who have not prioritized HIPAA, privacy, security, and breach notification compliance programs in their organization. So who's eligible for being audited? Well, every covered entity and business associate is eligible for an audit starting in the fall of 2014, which is now. The OCR starts with 300 to 500 desk audits, which are comprehensive off-site audits in which they request your policies and procedures and supporting documentation to show that you are in compliance. They also will be surveying over 1,200 entities governed by HIPAA. They plan to survey over 800 covered entities and 400 business associates. Of those, they plan to select a pool of 350 covered entities and 50 business associates. Their goal is to focus, of that 350 covered entities, they want to focus 100 of those entities are going to look into their privacy rule compliance. They especially want to look at your notice of privacy practices and the individual's right of access to PHI and how compliant you are in those two areas. Another 100 covered entities, the focus will be on the omnibus rule, which will be, I'm sure, patient costs to produce records being charged at labor costs, timely right of access, and the breach notification requirements. And then the last 150 covered entities, the focus is going to be on the security rule and risk analysis. From those covered entities that they pull and that they audit, they will take a listing of all business associates that they're contracted with, and of those, they will select 50. They will focus on compliance with risk analysis and breach notification of the business associates. So again, how are you chosen for the audit? Well, you could be this unlucky orange daffodil in this bed of flowers. It's random. They look at the criteria of your organization, such as whether you're public versus private, the entity size, your level of revenue, the number of patients you treat annually, the number of employees that you have, and the use of your health information technology within your organization. They also look at the type of entity, your geographic location, and again, what your affiliation is with other healthcare organizations. So who is the auditor? Well, back in 2012, the OCR had used KPMG. They recently announced that their intention is to handle these audits on their own, starting in 2014. In general, the entities selected for the audit will receive a notification letter from the OCR and ask to provide documentation. The documentation will encompass your policies and procedures. Every audit will include a site visit, which lasts between 2 to 5 business days, and will result in a preliminary audit report. KPMG will summarize these findings, or the OCR, and they will share those findings with you in their preliminary report. That will give you an opportunity within 10 days to respond to their findings and give your analysis and steps for mitigation and remediation. Again, the final report will explain how the audit was conducted, what their findings were, and what actions your organization is taking in response to those findings. So how does the OCR notify your organization that you'll be audited? For on-site audits, the OCR will call to verify contact information, then you will receive a letter via registered mail. Once that letter is received, you can expect an on-site audit within 30 to 90 days. Most commonly, the letter is sent to your CEO or the clerical staff of your executive administration. So the OCR notification clock starts at the time of the signature of the letter. You as an organization, as a covered entity or business associate, have 10 to 14 days to provide documentation to the OCR. I'd like to share with you a little further, timeline of how this process works. From what you can see here, the notification letter is sent to the organization. You have a minimum of 10 days to provide the documentation that is asked of you in the notification letter. From receipt of that documentation, you can expect an on-site audit within 30 to 90 days, in which that auditor will spend up to 3 to 10 days on-site. After that, a draft audit report will be provided within 20 to 30 days, and you'll have approximately 10 days from that point to review and comment back on the draft audit report. Once the OCR receives your responses, you will receive a final audit report within 30 days. So what is the audit protocol? Again, we know in general the OCR audits us on HIPAA and high-tech privacy, security, and breach notification. But of that, what specifically? They target particular provisions that were a source of a high number of compliance failures back in the 2012 pilot audits. The audits, again, are a type of review that serves more as a compliance improvement tool than an investigation of a particular violation that may lead to sanctions and penalties. The audit is uncovering vulnerabilities and weaknesses within your organization that can be appropriately addressed through corrective action on the part of the covered entity or business associate. So again, the auditor analyzes process, controls, and policies of the selected covered entities pursuant to the High-Tech Act audit mandate. The OCR website, which I have referenced here, contains the requirements to be assessed through these performance audits and describes the process in detail. If you choose to review it, which I highly recommend, you will find it to be very informative. The audit's organized around modules. They represent separate elements of the privacy, security, and breach notification rule. The combination of these multiple requirements can vary based on the type of covered entity that's selected for the review. We'll discuss further these modules and how they're broken down and what you can anticipate them looking into. We know based on the 2012 audits, now keep in mind, they have not conducted any additional mock audits in 2013. So we have to base our data on what we saw back in 2012. And they focused their findings on 9% of the breach notification rule, 26% of their modules were focused around the security rule, and 65% were focused on privacy. You know, it's important after you attend this session today to not really leave here only focusing on preparing for passing an audit, but to really continue your journey as an HIM professional, a privacy officer, or compliance officer in protecting the privacy and security of protected health information in your organization. You know, passing the audit is really just a byproduct of an effective compliance culture. So let's take a closer look at the criteria that the OCR is looking at. We know that they focus on 167 criteria, which can be found on their website. I will show you in a later slide exactly how that criteria is listed. 81 are focused on the privacy rule. 78% of the criteria are security, which encompasses administrative, physical, and technical safeguards. And then 10 of the criteria focus on the breach notification rule. An important fact to note is that the OCR recently stated when they look at the privacy rule, they're going to focus on the notice of privacy practices that the covered entities have created because recent updates were required under the omnibus rule. They want to look at the rights to request privacy protection of the protected health information, access of individuals to their PHI, uses and disclosures of PHI, amendments, and your accounting of disclosures policies. So let's take a moment and have a poll. I'd like you to take a moment to answer these questions to see how many of you have received an OCR complaint inquiry, and if so, what type of category of the omnibus rule and the HIPAA rule has it followed?
We'll give it just another minute or so for everybody to submit their votes. Okay, we'll close the poll.
Okay, so based on our results of attendees here today, 67% of you have seen OCR complaint inquiries around impermissible uses and disclosures of protected health information. I find that to be very interesting as the privacy officer of a release of information company, that is an area of concern, and so was it of the OCR from what they found in their 2012 audits. is that disclosures of PHI are not being followed under the privacy rule. So when we look here on the screen, this is an example of what you will find on the OCR's website of the 167 criteria. You can find these requirements and you can separate them by privacy, security, and breach notification. From what you can see, they give you the section of the privacy rule that will be followed. They list that specific criteria, what type of key activity that they recommend that your organization follow for compliance, whether it's conduct a risk assessment, acquire IT systems and services, develop and deploy an activity review process within your IT department. Then they'll talk about what their audit procedure will be and whether or not the implication is specific or required for your organization. Oftentimes, we as a business associate, we went in and printed these requirements and compared them to our level of service offering, what our requirements were as the business associate. And we found it very interesting that we had very excellent procedures in place that helped us be compliant with this provision of the rule, but we needed a stronger policy. So our efforts were to revise our policies to really encompass the level of procedures that we have in our organization. So let's talk a little bit more about these desk audits. Well, all the policies and procedures and strategic plans are due within 15 days of receipt of the letter from the OCR. It's important to note that any signed policies or procedures that are after the date of the letter that you received are not eligible to be submitted for the audit. But what other information are they asking for? They're asking for a list of employees that were recently termed and hired in the past 6 months. The reason why they're looking for some of that information is to see what type of HIPAA training is being done in your organization. How is your termination process for the right and level of access to the electronic health record? It's important to note also that for the on-site audits, the data collection usually occurs within 3 to 10 days after they perform the desk audit and look at the policies and procedures. And again, all on-site audits can last up to 10 business days. So when we look at the on-site data collection, it involves up to typically 5 auditors. The on-site visit will include interviews of key personnel, other staff members, site walkthroughs. They'll look at your operational process. They will even interview random staff and management. The general focus for the audit provided is it's not scripted. I mean, they're going to look at your policies and procedures, walk through your organization, see where you're following those policies, and ask questions. Keep in mind that of the 5 auditors, 2 focus on security, 2 on privacy, and 1 on breach notification. But it's important to note that the audit doesn't end when the auditor leaves. Post the on-site audit, the audit team will deliver a draft report to your covered entity or business associate within 20 to 30 days. You can expect continuous questions on a daily basis from an auditor for further clarification or possibly additional documentation. Your audit response team should really expect these questions and be prepared to share your findings and additional documentation with the OCR. So the audit response team within your organization should review the draft report that was provided by the OCR and respond to all deficiencies that were noted. Identify clarifying questions that you may have regarding a deficiency that they noted. Document mitigation information that you already have in place and your plans for remediation. Your team should really utilize advice from your legal department and even consultants to help developing a very good response to the OCR. So now that we talked about the audit process, from receipt of the letter to who the auditor is and how the audit process works, let's talk about how ready your organization can be to prepare for an OCR audit. The strongest way that you can prepare is to develop a governance risk committee or an audit response team that will be used to not only prepare for the OCR audits, but to manage and mitigate risks of all regulatory requirements within your organization. An audit response team should identify all potential auditors, whether it be someone at the state level, an attorney general. You can be audited on meaningful use, and you need to make sure that you're looking at the preemption analysis between state privacy laws and the federal HIPAA laws. This committee will address regulations and business requirements and focus on accountability within your organization to keep down costs and support risk management and overall compliance within your department. We'll take time for another poll. We'd like to know how many of you are on an audit task force or have been in charge of responding to complaints or inquiries by the OCR.
We'll give it another few seconds here for everybody to cast their votes. Okay, we'll close the poll.
So it's interesting to note that 44% attending here today do not have a task force within their organization. 15% have a task force and are a member, and 41% have a task force in their organization, but at this time are not a member. So, we can see that some of us are really preparing and some of us have a way to go, but I hope after today's session, you'll have some information to share within your organization and kind of be a leader in an effort for OCR compliance and preparation for an audit. So let's talk about, what do we typically see as on the audit response team? Well, it's not only an IT-driven response team. The HR department and education department should sit on this committee, the privacy officer, a physician, a nurse, the compliance officer, security officer, CEO. The government response team should report to the executive board. This audit team should report to the executive board and oversee the entire audit process. For IAUD Incorporated, we have different representation, a little bit different than what you see here. We have someone who represents our disaster recovery team, our electronic delivery team. We have accounts receivable. I myself am on the task force, our human resource department, our HR department, someone from our training team. So we have a really strong pool of candidates that can help lead the compliance initiative within our organization. So how can you be ready for an audit? Well, develop a plan for interaction with the OCR's audit team. Identify key personnel like we just discussed. Your privacy officer, your compliance officer, your director of training, your HR department, by giving them key coordinated activities and assigning them to certain policies and procedures. When these team members have clear roles and responsibilities, it helps the audit to be more successful because that is a point of contact for the OCR auditors. We have recently undergone our second SOC 2 compliance audit and passed with flying colors, which we're very pleased about, but our compliance officer leads that initiative for us. And she has conducted mock audits and assigned certain tasks to us. And we annually review, actually monthly review, our policies and procedures based on the ownership of that policy. And again, those ownerships are divided by key personnel and again the key responsibilities that we have within our organization. Once you have your audit response team, you should conduct a risk analysis on your own organization to determine exposure and how to best manage risks appropriately and to better prepare for the OCR audit. Focus your risk analysis on confidentiality, integrity, technical infrastructure within your organization. Look at your mobile devices and laptops for encryption. your availability of electronic protected health information, and any privacy concerns that you've had reported to your organization. Just determine how to sufficiently reduce these risks and vulnerabilities to a reasonable and appropriate level that you will not be ashamed of reporting to the OCR. I'd like to share with you one of the tools that we use within our organization, which is more of a control catalog. It's similar to what you saw of the criteria that's listed on the OCR's website, where we list the federal regulation, we talk about the policy that we have that governs that regulation, and then we break it down to a specific procedure that we have. We look at the description of that procedure, we take a sample size of employees that should be following that, and we look to test whether that they are being compliant, and we determine our results. And then we decide, what do we need to do? Do we need further education and training of that employee? Was their access level not available for them to be able to successfully complete that? One of the areas we look at is, just in this example for release of information, is when a valid authorization is provided for the disclosure of health information. One of the steps that our employees have to do is check for the core elements and statements that are required of a HIPAA valid authorization. So we take that exact step, we monitor up to 60 employees, making sure they're validating for those steps, we record our results, we look for where we may have had deficiencies, and then we move forward on a proactive basis. You know, this is how we prepare for our own mock audits. But let's see what the OCR found when they conducted mock audits back in 2012. They found that most organizations and covered entities were not compliant or had impermissible use and disclosures of protected health information. There was a lack of safeguards of PHI in place. There was a lack of patient access to their protected health information. Uses or disclosures of more than the minimum necessary of protected health information was occurring, and there was a lack of administrative safeguards of electronic protected health information. So the tasks in order to combat those mistakes, and what they found, was that the organizations did not have a prioritization of HIPAA compliance. They didn't have strong documentation in their policies and procedures to show that they were trying to be compliant with the patient right of access or the minimum necessary. They weren't able to prove enough evidence of compliance. They may have had strong policies and procedures, but they couldn't show evidence of compliance. Another area of concern was that they didn't see consistencies in all areas of the covered entities' practices, as well as the business associates who were working for those covered entities. And through interviews that were conducted by the OCR, it showed that management was unaware of where to find these policies and procedures that were being asked of them. So when you hear these concerns, one of the high recommendations of the OCR is called the 4 C's of your policies and procedures. And they ask for your policies and procedures to be complete, compliant, current, and consistent across all areas of your organization. Let's take another moment for our last and final poll. Just another second or so, and then we'll close the poll. So it's important to see here today that we have, all of us attending, or the majority of us, do have annual reviews of our policies and procedures. One thing that IOD has done that I found to be very helpful, because I am in ownership of quite a few of our privacy policies, is we have monthly reviews. It's easier to tackle. You can focus more on the details and get a larger group available with a smaller amount of data to look at. So we do annual reviews, but break them down by monthly, certain policies per month. So let's go back to talking more about our leadership by our audit response team. You know, it's very important that there's a positive attitude amongst your audit response team, that by having good preparation, it creates successful outcomes. They should develop a process that ensures compliance with the HIPAA privacy and security audit program and communicate back to your organization the feedback that you need to know for where areas of improvement are and where you pass with flying colors. Another recommendation is that the OCR recommends that you look at the NIST 800. It lays out a plan for audit preparation. It's the National Institute of Standards and Technology. It discusses in there how you can conduct frequent meetings to collect observation and get staff input. It gives you the tools on noting deficiencies that your team has had with responding to audit questions, how to engage consultants and legal advice, and how to focus on plans for remediation and timelines within your organization to improve upon your findings of your audit. So again, we feel that if you have an audit plan and an audit response team, you can ensure success in preparing for the OCR audits. I'd like to take a minute and share with you IOD's approach to OCR compliance. IOD is constantly scanning internal and external issues. We look at high-risk and problem-prone breaches that are used out in the media to create newsletters and improve general awareness within our organization. We feel that we find it very successful if we can share scenarios and breach stories that are out there instead of providing a strict policy to our staff. While our staff members are aware of our privacy and security policies, sometimes hearing about the scenarios and how to handle them is a much more effective way of training. We also conduct internal audits and risk assessments. We are happy to work with our covered entities and come on site and do our own internal risk assessment and audit and provide that feedback back to compliance officers as well as our own to better prepare for an audit. We focus on our business associates and we work closely with our covered entities to make sure our policies and procedures are in line. It's very important that we manage any potential third-party risks because if you look back at our second slide that talked about the 538 breaches, 56% of those were caused by business associates. So it's very clear that business associates need to be accountable for the requirements of privacy, security, and breach notification. IOD processes over 3,629,000 requests for protected health information annually. And if we know the OCR's focus is on patient right of access and minimum necessary, it's key that we as a leader in release of information and as a business associate must be compliant with the privacy rules. Again, we've taken the OCR audit protocol, we've looked at the NIST 800, and we use that as an internal tool. We downloaded those 167 criteria and created an organizational reference tool for ourselves. We identified and documented how our organization meets compliance to those protocol criteria through activities, educational trainings, policies and procedures, and et cetera. But another approach that could be a more formalized method for tracking is to go with the software. Audit Tracker is a commonly used software out there in the industry that's a quick-based application. It is recommended security audit repository, which has been incredibly helpful if not only managing current audits, but also in integrating and prioritizing past audit results. The Audit Tracker really allows for assignment of tasks and notes and follow-up polls for your team member as well as different departments within your organization. Another large focus from the OCR that they have stressed in a recent article is to identify all your business associates within your organization and be sure that your business associate agreements are in compliance with the omnibus rule. You need to address assurances that your business associate is compliant with privacy, security, and breach notification. They should be willing to share with you their audit results and their risk assessments. Consider the size and scope of the business associate arrangement that you have within your organization and what potential impact that business associate has to breach and security incidences. Monitor industry-reported breaches for business associate concerns and I really strongly recommend that you consider annual communications with your business associate's privacy officer and compliance officer. Another area of focus is really monitoring your breach management process. IOD recently purchased a software that is helping us streamline and manage breach and privacy or HIPAA incidents. Since the breach notification requirement was established in 2009, we continually refine our processes to ensure identification, investigation, and response in a timely manner to be compliant with our business associate agreements. Some of our key areas that we focus on for minimizing risk is we focus on targeted training, education, and awareness. We're always looking at external potential auditors and what they're focusing on to do our own risk assessments. And we prepare and document in anticipation of an audit to show what our compliance efforts are. You should also make sure your breach management process is centralized to one area. Again, target high-risk areas after you've done your own risk assessment. Refocus your training and education and awareness. I can't stress enough reducing the academics of privacy and the security role to focus more on breach scenarios. We do this frequently in our newsletter articles as well as our own internal professional social media communication board that we have through Yammer. We find that to be very helpful in where we post various privacy requirements or questions that are asked and how to handle that privacy right of access or right of disclosure under the privacy rule. Look at your high-risk problematic areas. Are you having issues with unauthorized electronic health record access, lost or stolen devices, and social media within your organization? And make sure you have strong policies around those areas. So again, evaluate your policies and procedures and refine them as necessary. Create and review and revise them, and perhaps you need a template to be customized to help your organization meet those requirements. Hold your workforce members accountable, and most importantly, share those policies and procedures with your business associates and other partners. And again, remember, strong breach and sanctions guidance are required, and you should have a strong breach violation policy within your organization. Because if there's a lack of compliance, what's the cost? And when you look at this slide here and you see some of the violation penalties that have been assessed to different organizations, I don't think any one of us here wants to be faced with those types of fines. Again, handling the audit process is not easy. Recognize that security is a good thing. The OCR wants what you want for you and your patients. If this will help keep your name out of the paper and your PHI secure, that is what is most important. Recognize that you can't do it alone. We're talking about a massive number of policies and procedures affecting the entire organization and your business associates. You need to be helpful and cooperative by being on an audit task force. Thirdly, it will take time to even figure out where you are, much less make things better. So be prepared for a marathon and not a sprint. You can't make changes overnight. And fourthly, remember it can be done, and you can be instrumental in making it happen within your organization. So we'd like to take this time to answer any questions that you may have. Please feel free to submit those questions here. One of the questions that was posed is, I have heard that there has been an increase in OCR complaints regarding the patient right of access at labor and costs to produce the medical record. Is this something that you are seeing as an ROI vendor? Actually, this is a great question because this is something that we are seeing. as a national release of information vendor and with the final omnibus rule, they stated that you can only charge a patient your actual costs and labor to produce the medical record, whether it be in paper form or electronic form. And it required you to do an assessment of your costs and labor and determine if they are lesser than the state rate, you need to be charging that state rate. So we've done a thorough, analysis. We've developed our actual costs to produce, and we had to, again, assess the state rate versus the federal actual labor costs and implement those charges. But we see that, many entities out there haven't really looked at that piece. It's not a high priority within their organization, but it is a source of numerous OCR complaints where attorneys representing these patients feel that they have a right to that fee structure, which is not the case. The basis of that fee structure is to be provided to the patient. So we are seeing complaints of that nature coming to us and investigations, and we feel strongly, that we are compliant with that effort. There's some questions regarding will the slides be available for printing, and will the PowerPoint be available for download? Yes, we can make sure that that is available when you receive your continuing education email tomorrow. So there's a question here, if our cost is lower than the state rate, can you charge the state rate? No, if your cost is lower than the state rate, you must charge your actual cost to produce the record. Keep in mind, say you've calculated your cost at 30 cents a page and the state rate is tiered. For example, the first 200 pages are 50 cents, the second 201 and up are a quarter, and you've calculated your cost at 30 cents, you want to be sure you take into consideration that tiering. So you charge 30 cents for the first 200, 201 and up, because the state rate is less than your actual cost of 25 cents, you would then apply that state rate, that lower rate. So you kind of really have to look at the state statute and what your costs are. Okay, are there any other questions out there? I see one asking is this OCR audit relatively the same as a joint commission audit? I would say yes, it is. Only, the OCR is very open about those criteria that you need to follow, very much based on your policies and procedures and documentation supporting your compliance with those policies in your organization. Okay, well, thank you very much for joining us today. I hope that you found this presentation to be quite beneficial and gets you moving towards further compliance within your organization regarding privacy, security, and breach notification.
Yes, thank you everybody for joining us today. If you would like to set up a time with your IAD representative on how to discuss how we can help you prepare for OCR audits, we encourage you to do so. And again, a reminder for your CEU as well as for the presentation to keep an eye out for an email that will be sent to you tomorrow from IAD that will contain the information on how to obtain these copies. And again, thank you everybody for joining us today, and we look forward to meeting again with you soon.